I think, first of all, I would say that general practice is changing rapidly. We have a population that's getting older, that is often iller and has more complex conditions. So the whole nature of general practice is changing. SPIRE will help by providing practices with a simple way to view their own information and to get intelligence from that will be of use to them in the care of their patients, particularly those with chronic diseases like diabetes and heart disease, but also for older people with a lot of conditions who are on a variety of drugs. Well, say if general practice wants to look at, say, the care of its patients with diabetes, for example, then they will be able to use SPIRE to give them a readout of all the relevant information on patients with diabetes, what their blood pressure, cholesterol, HbA1cs, that's the long-term measure of diabetes, are, and drugs that they're on, of course. So they'll be able to look at that and see how they might both look at individual patients and improve their care, but also look at how they organise the care, say, for diabetics in their practice, to improve the experience for patients and to help the smooth running of the practice as well. GPs are always short of time, so anything that makes it simpler and easier to get the information that you need, to get, say, a dashboard of your patients with diabetes, will certainly help to improve the care of patients with these conditions. And not just diabetes, but obviously other chronic conditions as well. So it's simplifying the process, reducing the amount of time that practice admin staff have to spend to get the information that GPs need to look after their patients well. The NHS in Scotland has traditionally had quite a lot of data about what happens in hospitals, because hospitals gather data and they've got a fixed population who are in hospitals. General practice is different because our patients come to us when they need a service. So what SPIRE will do is it will enable, in a safe and secure way, the information that's in these 1,000 practices to be used perhaps at a health board level, or integrated joint board level, and at a national level to plan services for patients better. It's as secure as it possibly can be. It fits in with UK safeguarding and information governance principles, which have been thought through and recently revised. I think the main thing is that we need the data, and actually patients in Scotland deserve the standard of care that this information can provide, and the NHS, Scottish Government, National Services Scotland have made it as secure as it possibly can be.